We have been very careful to practice good self-care, so trying not to overload any one of us, but to keep us working our shifts.
It's not just people responsible for people's physical well-being during the pandemic who are facing challenges. Good evening, everyone. I'm Brooke Martin.
And I'm Sierra Hignite. The workload for those caring for people's emotional well-being is also on the rise. News 8's Demi Johnson is live at IU Health Methodist tonight. And Demi, hospitals, they're not just caring for COVID-19 patients.
Yeah, there are still large numbers of people with illnesses and other diseases whose families have to make tough decisions. Many times they look to chaplains for answers.
All that thou hast made. Give us the
It's a job that can sometimes go unnoticed.
It's more the intensity of the emotions.
But at times can be one of the most important in a hospital.
Follow-up care, sometimes it's initial visit care. Many times it's providing visits for those who are most critical, providing care to the families.
The care Director of IU Health's chaplaincy program, Vern Farnham, is referring to is mostly emotional, and the way chaplains are getting the work done has become extra challenging during the pandemic.
Chaplains are not typically the most technologically savvy people. We prefer face-to-face conversations, so we had to learn really fast how to use FaceTime and Zoom.
Not only are they finding new ways to care for people, their workload is increasing too.
And also our care shifted where we were doing a lot of staff support.
Farnham says staff has always been able to reach out to chaplains for help, but right now they're doing it more than ever before.
The number one thing we hear from staff right now is fatigue. We are all tired. We're tired of watching people suffer with COVID-19. Yes, watching people die, but also we watch people who have COVID-19 and we're concerned for their future well-being because we don't completely know the long-lasting impact of this on a person's health.
He says always helping others can weigh heavy on a chaplain's mental health.
The biggest part of my job is to support my staff and caring for them, making sure that they're getting their time off, making sure that when they've had enough, they come off the units.
As for him, he prioritizes time with family and says the biggest help he could ever ask for can only come from the community.
It's better for all of us to be concerned about one another and protect one another by wearing a mask and washing your hands and practicing social distancing.
Farnham says chaplains are still doing some face-to-face visits in some situations. We'll have a full list and a link to all of IU Health services on our website later tonight. Live downtown, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.
Demi, thank you. There are 5,700 new coronavirus cases in Indiana. That brings the total number of people diagnosed in the state to now more than 387,000. 42 more people have died. Those deaths happened between September 28th and December 6th. 5,986 Hoosier deaths are now linked to the pandemic.